My name is Demiki Houston, and I am a member of Sigma Gamma Rho sorority, the Eta Pi Sigma chapter here in Grand Rapids. We do a lot of volunteer and just trying to make sure get awareness out. So if that's passing out flyers, that's talking to people about getting tested. We do a lot of things like that. I try to advocate for those in our community because personally, I know people, friends and family who've been impacted by this and about HIV and AIDS. And so my whole thing personally is to advocate and get people informed because a lot of times they're miseducated on what it actually is and how it impacts the body and individuals. So that's what I do and hope to continue to do that in the future.
Yes, my name is Carolyn King, and I am a child and adolescent psychiatrist, and I'm representing Alpha Kappa Alpha Sorority Incorporated. We were founded in 1908. We are the first Black sorority. Our vice president, Kamala Harris, is a soror. And so that has been a huge deal for us this year. However, we've been around for over 100 years, as you can see, 1908. And this year, as every year, we have target items that we are focusing on. This year, women's health and global impact are two of our 5 target areas. And so the RED Project and World Awareness Black HIV Day is very near and dear to having a global impact, and especially when it comes to women's health, because I think a lot of people forget that women have children, and children are born with HIV sometimes, and women are the receptacles and can get HIV from their partners.
My name is Curtis Lipscomb. I'm the Executive Director of LGBT Detroit, and I have been doing social justice work since 1992, and that work started and was rooted in 80s activism. As I'm a man that witnessed the birth of the HIV pandemic in the United States, and as an out young teenager, that horrible time has impacted my entire life.
Hello, I'm Sinema Machireddy. I'm a family practice physician. I work at Cherry Health. I've been with Cherry Health for almost 8 years. I provide primary care to both adults and pediatric population. So with regards to HIV prevention and treatment, I provide pre-exposure prophylaxis to high-risk patients who are at risk of acquiring HIV. And also I treat a small amount of patients who have HIV infection.
My name is Ernestine Torbert, and I am a member of the Grand Rapids Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I have been with this organization. I'm kind of a newbie to this organization as an officially member. I've been with it 4 years. This organization was founded in January 13th, 1913 at Howard University by 22 collegiate women, which is a private and non-profit organization whose purpose is to provide assistance and support through established programs in local communities throughout the world. As a matter of fact, last week we just celebrated 108 years as a sorority, as an organization. The Grand Rapids chapter was chartered on November 17, 1968 by 13 professional Black women here in Grand Rapids. And our mission is to focus is to educate and provide service. We are a service organization. We are founded on 5-point programmatic thrusts, which is educational development, economic development, international awareness and involvement, physical and mental health, and political awareness and involvement. We with this organization partnered and can partner with RED Project to amplify the needs to educate our community about HIV and AIDS awareness. We want to make sure that our minority communities are included in the outreach efforts and conversation about this disease.
Hello, my name is Lorenzo Bradshaw. I am an educator. I'm the principal of Brookwood Elementary School in Kentwood Public Schools. I'm also a proud member of Kappa Alpha Psi Fraternity Incorporated. I was initiated at Johnson C. Smith University in HBCU in Charlotte, North Carolina, and we believe in serving the community, and our overarching goal is achievement in every field of human endeavor. With that being said, we believe in service and altruism, unselfish concern for the welfare of others.
My name is Melva Martin, and I'm 49 years old. I've been HIV positive since I was 19, so that's over 30 years, because I will be 50 this year. So I've been HIV positive for 30 years.
Hi, my name is Andrani Henry. I am an emergency physician by occupation and a member of St. Philip's Episcopal Church. As part of my service to the church, I'm also on the board of the John Burgess Wellness Center that provides health and wellness education and activities for the Grand Rapids community, particularly the communities of color in the Grand Rapids area.
My name is Vanessa Green, and I am the Chief Executive Officer for the Grand Rapids African American Health Institute. And our primary mission is to provide awareness and education around health disparities in efforts to create greater health outcomes, particularly among the African American community and other marginalized communities.
Theme really means that as an individual, we can do work, but it's not going to make the impact that we want. And so when we work collaboratively together as a unit, we can do more and kind of help push the awareness more in the communities. It's kind of like that saying is, a single rope isn't as strong as two, but three is unbreakable. So the more people that you can collaborate with or unify with can actually help impact the community a lot more. So where we can be more aware, and so that way we kind of be more proactive instead of reactive to certain situations and information when it comes to HIV in the Black and Brown community. But it really is more about how do we kind of slow this thing down and kind of prevent it in the future.
Well, I love the title, We're in This Together. I think that it could not be a more timely topic to think about how we're all connected. And so when I think about we're in this together, we're all in this together, I think about my first recollection of even knowing what HIV was. And so I'm a little bit of a storyteller, so I'm going to tell a story. So my cousin Lyle lived in the DMV, DC, Maryland, Virginia area, and it was the 80s. And he became HIV positive. He was gay and in the military. And he, had courage. He had the courage to come out and let us know that, of his sexuality. He had the courage to let us know about his eventual HIV status. And he had the courage to volunteer for the AZT trials. So they were going on at in Bethesda, Maryland. A lot of the National Institutes of Health and are there. So that is just one piece of the story. So as I start digging deeper into AZT, just to make sure I have my dates right, I find out that Dr. Horowitz was at Wayne State School of Medicine. He actually discovered AZT in 1964. They were going to use it for cancer, but it didn't work. Now, Wayne State School of Medicine is my alma mater, okay? So he was there when I was there. He just made this transition in 2012. So they put it on the shelf, and then around the 80s, this disease, this retrovirus came out, HIV, and they started using it on that and saw that it had success. So here we are. You see how once you start to look for your connectedness, you can find the connectedness. And so as we look at how are we all connected, we will all know someone who is affected by HIV status, by AIDS, by the trajectory that it brings in the community. But we have to look for that togetherness, that connectedness, so that we can feel it, so then it becomes important, so we can do something about it, right? Because if we don't feel it, we won't do anything about it.
I couldn't agree that that's a motto that we should all stand behind. As a person who is African American, male, Midwesterner, social conservative, out, there's a number of identities that are visible to the public, and there are many that are not so visible. And so there are a number of spaces where we show up, and for many, our health issues and how we seek health care is an issue that a number of us should pay attention to. The HIV epidemic has taken a lot of my friends, and how we engage with one another hasn't changed in a very long time. And so remaining safe, keeping our spirits up, always creating methods where people will not get infected with HIV, and helping those who are affected is key to everyone, whether you are a parent, a child, or a neighbor. All of that's key in making sure that the spread of HIV stops.
I was born and raised in Mississippi, and you've heard the phrase, the slogan, or whatever, it takes a village. Now, a village is someone working together, everybody in that village working together. To me, it has always been, you're not in this alone. You need someone. We have also heard the expression of, I don't need them, I can do it by myself. But no, we need each other. God made Eve because he didn't want Adam to be alone. So we, with anything, we need each other to survive. That is it. And if we can understand that and know that working together, we can progress so much further and so much faster. The word also said, if two are together, it brings about a better results. If one falls, the other one can pick them up. So that is a very important phrase. We are in this together. And when someone hears that word, that I'm here for you, we're here together, and we can do this, it makes a lot of difference.
The thing we're in this together simply means that as a community, we must work together to combat stigmas and misconceptions about HIV and AIDS. We do still recognize that there are a disproportionate number of African American, particularly men, that are still disproportionately affected by HIV and AIDS. And so with that, we must combat, we must dismantle, we must also work as a community to provide resources and support to educate communities of color about HIV and AIDS.
I mean, but you're not alone. Other people share your situation, and we're here for you. We're here for each other. We can help each other. We can lean on each other. It may be scary, but you're not alone.
For me, we are in this together is just a representation of not only the shared experience of Black people, but the shared experiences that we all have in our different communities. Whether it's standing on the shoulders of giants or being part of the village that raises a child, we're all going to rise and fall together. And so we all benefit if we're all pulling in the same positive direction that benefits the community as well as the personal.
Well, I think that essentially in terms of all my roles, my response and interest in this theme would be the same as we think about the fact that there are 40 million people worldwide living with AIDS. It's a global epidemic, which means that it needs to be a global concern of everyone. And I know that when I worked on my graduate degree at Grand Valley State University, one of the projects that I did, and this was back in the early 80s when HIV/AIDS first hit the surface, and it was always allocated and understood as something that was presented as something that was specific to gay men, and we know today that that is not true, that essentially anyone who is sexually active are susceptible to contracting HIV, which means that it is something that we all need to be aware of, educated about, and understanding what are some of the preventive causes of that we can take to eliminate the contraction as well as the spread of HIV. And I think that the more aware we are and the more educated we are around this virus, the more each of us can have a role in eliminating the spread.
I think some of the missing pieces is in certain areas, people not forgot how serious this can be, but a lot of times I think because there have been so much change when it comes to medication and medical availabilities, people have not taken it as serious as it used to be in like the 70s and 80s. And I think that's where the missing piece is the continuing to keep the seriousness of it and understanding the risk factors, especially within our younger generation, the 12 to 18 year olds, I think up until like the 22, 24 year olds, a lot of them don't really take it as serious. And so a lot of times when there are dealing with people in relationships, they're not asking those questions, they're not getting tested, and they're just living their best life, as people say, right? YOLO, you only live once, but they don't really understand the seriousness behind it. And I think that missing piece is continuing to educate our younger generations about the seriousness of HIV/AIDS.
I think that the awareness is a huge issue. Back to the 80s when HIV first hit the scene, and AIDS first hit the scene, there was a huge awareness that this was a thing. So HIV has kind of fallen off the radar of people. But yet we have COVID, another virus that has taken hold of us and that has gained a huge amount of awareness. And so it is time for us to educate about virus. So the viri, the plural virus, right? The viri, including HIV, which is a retrovirus, including corona, which is a virus, including other viruses. What's the difference between viruses and bacteria? Like, people don't even know sort of those basic differences. So the missing puzzle pieces is education, awareness, so that we can have prevention. Erasing the stigma. One of the things I had to look up was sex worker. because I didn't know what a sex worker was. I thought, oh, a sex worker is a prostitute. And then I realized people who are in the arts who pose, they're sex workers, technically. People who are on phone calls. So there's this indirect contact for the sex worker world. And hearing that helps to destigmatize what a sex worker is. And so as we see the faces of people like Magic Johnson who are living with AIDS, healthy and happy, those faces and names, we still have to keep them current so that the awareness and prevention can go on. Because I think that's the missing link, is the awareness part of it.
There is still HIV stigma. I think it's easier for others to say that I may be infected with coronavirus than to be infected with HIV. And so the pressure to say publicly that I am a victim of a health crisis is very difficult. I know that when it's said or it isn't in existence, then the person who is most impacted by HIV can seek care. And I believe that once that stigma goes away, totally goes away, a caregiver, a friend, anybody concerned about the individual can say, hey, I am aware that this has impacted your life, and I'm offering some kind of solution to it. It could be a shoulder to lean on, it could be advice, it could be a linkage to care, it could be other kind of psychosocial services that would help with the person who is infected and affected with HIV. A lot of opportunities can occur when stigma is set away.
I think what is missing a lot of time is the accessibility of resources. You know, there are a lot of resources in this community, but if you don't have accessibility to these resources, it's not going to do you any good. And also, I think inclusiveness. We have to include each other in what we want to do for each other. You know, we have to know their thoughts and others' wants. You know, we have to bring in different age group, different nationalities, different living arrangement, because we might think one way that this would help, but you have to get that perspective from someone who is living in it or know about it. So being included in the decision making, being at the table, you know, being there, helping to make things happen for me and the others in the community. And as a nurse, we always have taught the body you save may be your own. So knowing yourself, knowing what you can accomplish, knowing what you want to do, knowing your body, you are the one that's going to know what's going on in your body. Someone might look at you and get a whole different perspective, but you know what's going on. So knowing yourself, knowing what you are capable of doing. And also, don't be afraid to ask questions. You know, some people think that, you know, oh, I might sound stupid, or that's not a good question. But if it's important to you, and that's how I let my students and everyone know, if it's important to you, it should be important to me.
As an educator, I believe knowledge is power. And the one area where we can further increase in awareness of HIV and AIDS is through education, particularly in the African American community. Knowledge is power, and we can dismantle and distill a lot of myths and stigmas when we're educated properly. Another challenge is the disparities in healthcare and providing adequate healthcare in communities of colors. Education combined with adequate healthcare will be a sure way to dismantle and distill a lot of the misconceptions about HIV and AIDS.
Well, a lot of times people aren't protecting themselves, or they don't have the information that they need about it. So they kind of try to keep it taboo, which is no longer, it's nothing to be afraid of, because there's medications that can help and stuff like that. But a lot of people are still in fear. So the fear causes them to not be together on it, kind of shame or run or try to hide from the situation.
I think there are several things that are missing in our fight against the HIV epidemic. I think one of the primary concerns that I have is that too few folks are aware of their HIV status. And so a person that isn't aware of their HIV status, if they're positive, they're more likely to transmit HIV to someone that doesn't know, to someone else. And so part of that is that we're afraid of getting tested, and we can be afraid of getting tested for many reasons, whether that's fear of the test result not being confidential, or fear of the testing process itself, or even fear of a positive result. And so that's really kind of my biggest concern, is that I think that one of the primary drivers of HIV transmission at this time is that folks just don't know that they're positive. What's missing? I think that we need to increase HIV testing availability and awareness in our communities. We need to have open and honest conversations about HIV with our children, with our family members, and with our friends. We need to increase education about ongoing care and treatment options for persons that are living with HIV and AIDS. And finally, I think it's important that each of us advocates and votes for policies that increase access to healthcare and decreases poverty.
Well, I think that one of the pieces of the puzzle that's missing, particularly like from my perspective and being in the African American community, is that we don't talk about it often, and as such, then we're not putting pieces of the puzzle together that any virus or any epidemic that the world experiences, it typically impacts lower income communities more, and because of like oppression in our society and lack of access to various different opportunities, then African Americans and the Latinx community typically are among those who live in poor communities and conditions, and don't have like access to the same resources and educational tools as others. As a result, then the spread of HIV typically impacts those communities more. And so I think that in terms of the puzzle to the conversation, that's something that is really important to bring about more awareness, and in ways that helps to create understanding and preventive tools, but also to help eliminate stigma within the African American communities and other low-income communities around HIV. And so some of the opportunities, I think that, when we look at what are some of the missing components, but then I think another part of that is like, what are the opportunities? And I think that education is always a great opportunity. And I think that the other thing that is missing is sometimes we don't know and understand like how our attitudes and beliefs and values are shaped by our cultures in terms of the way we have been socialized. And for example, as an African American living, like from birth, we are socialized into a particular culture, a particular way of being. And from birth, as an African American, then that child is going to be surrounded primarily in the early stages of their lives around other African Americans, their family, their relatives, their aunties, their cousins, uncles, and so forth. And so they're learning a lot of things very early on in life about their values related to race, related to economics, related to HIV. And so whatever lessons that they're learning at an early age, it tends to shape how they perceive and view those situations later in life. And so when I think about missing pieces there, I think that socialization, understanding of how our ideologies and values and beliefs are formed and how they carry out in different facets of life. For example, I remember specifically growing up, and this is like I was about 12 years old, and I remember sitting on the front porch of my auntie's house, and there was a guy in our community, and he was a little older than me. I think he was about 16, but he was gay. And I remember when he walked past, his grandparents lived right next door to my aunt. And so he walked past my aunt's house to get to his grandma's house, and there were older cousins who were on the front porch, and they laughed, and they would be like, "Oh, there's the faggot Kenny," right? And so and everybody would laugh and kind of like like tease Kenny, not necessarily in his face, but kind of just within that family context. So it didn't come from the adults in the family, but it came from like the teenagers in the family who were older than me. And so it informed my views and beliefs about, say, gay people. And then in the 80s, when I started doing research, and the research basically suggested that AIDS was something that was caused by gay men. So you put that together, and so here I am, like thinking like this is like about gay people, right? And so, but then over the years, as I did my own education and learning and having different understandings, and I was able to change those perspectives and understand where they evolved from in the beginning. And I think that those are the things that are very important as we think about ways that we can have impact, ways that we can change. We have to go back to those formative years of how were we socialized, what were the factors that influenced and shaped our values and beliefs, and then trying to unlearn those things and being very intentional about just kind of gaining new knowledge and awareness in ways that we can change our own ideologies, as well as in be influential in helping others to grow in theirs.
I think it may have slowed it down because a lot of people are trying to not get sick and not catch COVID-19, right? So we're more aware of our relationships, interactions with individuals and connections. But I think also it limits those who are impacted by HIV/AIDS and their ability to get to the hospital, get to their doctor's appointments, because they are a little bit more of a risk factor because they have a pre-existing condition that can actually impact them a lot more than those who have a healthy, strong immune system, even with medication and everything like that. So they become a risk factor with COVID-19. So it becomes a struggle for them. And I think that is a discussion that we need to have about how do we help those who are impacted, and making sure they continue to get the services that they need throughout this pandemic and even afterwards.
Gloving up was the thing back in the 80s, right? And condoms and this virus is all about masking up, right? And so the controversy about masking up for COVID was similar to the controversy for gloving up with prevention for HIV. And so you can see how people fight against changing their behavior. I don't want to put a mask on. And part of the fight is denial. It's not going to get me. It's only going to get those people. It was a lot of people who said, oh no, and this leads to your next question, the final question, Black people don't get COVID, right? And some people were like, oh no, Black people don't get COVID, so I don't have to do this, I don't have to do that. And so people were in denial. And so this epidemic that we have right now is partly been fueled because people were in denial. And so we have an opportunity. Again, I always am going to talk education. Our sorority is made up of thousands and thousands of teachers and educators, and that's really what we do, is educate about all of our different platforms. But having non-knowledge, having a level of not knowing, allows people to sort of go back to what they do know, which is comfortable and familiar. And when they go back into those places of what they do know, it feels very safe for them. But it's really an illusion of safety. It's not real safety. It's actually a very dangerous place to live in non-knowledge. And so, these people who live in non-knowledge became the super spreaders, right? They didn't want to mask up. They wanted to live in fear. They wanted to reinforce the stigma when it comes to COVID. They went so far as to even become sort of terrorists, right? And so the same thing happens with HIV. People who want to live in non-knowledge become scared. They reinforce stigmas, they reinforce bias, and then they are some of the people who say, things like, we want to have the freedom to not serve people in restaurants or people at businesses. I mean, that's really nonsense when you think about what the goal of living on the planet is, which is to live here together, and that we are all on this planet Earth together.
I have the fortune to sit on a task force to address racial disparities within the coronavirus epidemic. And the one thing that I thought could be an important moment for people who is a member of the HIV, a member of HIV culture, is to say, hey, as a gay person, I am well aware of a viral attack and what it's done to people. And so I think what coronavirus has done is, one, bring back some painful memories for those who are survivors of the HIV epidemic. And two, I think we're on the front line of saying to our friends and family, hey, I know some tools to prevent the spread of a virus. I, along with others, have relived memories of this period. And so many of us are brave enough to step right into the lion's den and say, hey, I'm here to fight. Again, being rooted in 80s activism, talking about behavioral change, talking about prevention methods, adhering to all other kind of recommended tools to reduce coronavirus infection, mirrors what we've learned, and it took a longer time to learn, HIV reduction.
And again, COVID-19 infections and deaths have demonstrated yet again the sharp divide and the disparities. So socio-demographic factors, racial and ethnic disparities, which are observed with HIV, have also characterized the population who are at high risk of COVID-19 infections and deaths. So if you look at the numbers, African American population accounted for about 25% of the deaths from COVID-19 infections, and then Hispanic population accounted for about 20 to 24% of the deaths from COVID-19 infections, which is really unfortunate. So as a provider, this reminds me of my mission again and again, and also my organization Cherry Health's mission, which is to provide patient-centered, high-quality care and improve access to vulnerable population.
We have done a lot of things on social media. A lot of people are not comfortable in getting out, being personable, being seen in public. But social media, COVID-19 has brought a lot of technology together. We can do things and we don't have to be right in the vicinity of each other. That is one way that it has brought us together. We can communicate across the world on this technology, but a lot of ways that it has put a gap. Also, a lot of in the minority community don't have the technology, so they are left out, and especially in the minority community, you know, our churches was our main social event. You come together, you see people, you touch, you talk, you cry together, whatever. And that has put a gap because they can't see each other. They can't be with each other. That touch is so important. You can't even hug. You can't even touch each other. So I think that has put a gap in talking and sharing about, you know, what's going on in our life, because we can get on the technology and we can look beautiful, fine, everything, but what's going on around behind the door, no one will never know, because you're on that technology and you're putting on a different face. So being able to be there, to listen, to watch them expressions is very good. And those are some things that I think, you know, has been good, but also has put a wedge between us.
It has really allowed us to hone in on disparities, particularly in communities of color. And so now we're starting to facilitate and have those conversations of how we can create more equitable opportunities for a community of colors. One of the setbacks in terms of HIV and AIDS, I believe that the pandemic has become such a major topic of discussion. A lot of the HIV and AIDS awareness have gotten lost. And so how do we take both of these, which are pandemics that disproportionately affect communities of color, and keep them both in the forefront? And that's a way that we can, again, continue to combat HIV and AIDS.
The COVID-19 has brought people together because it was something that the whole world was experiencing, and it was happening so quickly. And it was a scary situation. It was taking people's lives. And so people were focusing more so on the pandemic of the COVID-19 versus focusing on HIV so much. And it widened the gap because they took the focus off of what was going on and focused on something else. And so now it's like people aren't trying to protect themselves from it. They're thinking of something else, I guess.
What COVID-19 has done is it's normalized the concept of personal protective equipment use for the active prevention of the spread of a communicable disease. My wish is that this can translate to ending the HIV epidemic, such that things like clean condoms before intercourse are considered required PPE, or clean personal substance use equipment like syringes and needles are considered required PPE. I'd like to see our advocacy increase for pre-exposure prophylaxis and for post-exposure prophylaxis, as well as for clean personal substance use equipment, because if we can make our promotion of those treatments mimic our advocacy for the COVID-19 vaccine, I think we can really impact HIV transmission and decrease or improve the HIV epidemic. I think that COVID-19 has challenged our ability to end the HIV epidemic because it has decreased access to healthcare in many communities. Additionally, it has worsened the socioeconomic status of many Americans, but even more so many African Americans.
I think that people in general have become more sensitized about the value of life, the value of respect, and the value of human dignity. So my hope would be that would be like across the board, like in everything, as it relates to like the humanity of people and just the dignity and the importance of every life. This whole concept of the of lives mattering, Black lives mattering, and looking at, people who are oppressed and who have been, marginalized or discriminated against, and to have sensitivity for groups of people who are experiencing, just certain levels of rejection or, discrimination based on who they are. So I think that COVID has created, a level of sensitivity on some levels. But I think that each person has to be really intentional.
I think we could challenge the stigma first by having that conversation within our own homes. We kind of talked about it earlier. A lot of times, parents aren't communicating or talking to their children about HIV/AIDS and the seriousness behind it, as well as in our own friend groups and family, and having that dialogue and being able to feel comfortable and safe to have that discussion and conversation wrapped around HIV/AIDS, because it, like you said, we're in this together. It doesn't just impact us. It doesn't just impact the individual. It impacts all of us, right? The individual, their family, their community. It impacts everyone as a whole. So this isn't something that just one person has to go through and face. We all, in the whole community faces it. It impacts us in every different levels. Even if it's one individual who's living with it, it impacts everybody connected to that individual. And so it's about the conversation that we have wrapped around it, and understanding really what it is, how it impacts the individual, how to prevent it, and how to keep ourselves safe, and also creating a safe space to talk about it, because sometimes it's not a safe space to communicate, and the person who is dealing with this situation, they don't feel safe enough to communicate that to a loved one, a partner, or a family member. And so we have to be able to be comfortable to have that dialogue and that conversation with one another in order for us to kind of move forward in this.
Again, Alpha Kappa Alpha Sorority Incorporated is a global organization, and it is a Black organization, but we include all comers. We don't say, if your skin color is white, you can't be a part of Alpha Kappa Alpha. That's not who we are. We have white members as well. Unfortunately, the story of how we started is because we were not included in the white sororities. So, because there's a stigma about being Black at that time, okay? So let's go to, how there's this similarity in, the stigma of being something that people want to identify you as other. And you can't talk about being Black without talking about being in the Black church. And you definitely can't talk about being Black in Grand Rapids without talking about being in the Black church. So we have found over and over and over, study after study after study, if you want to have impact in the Black community, you have to reach the churches. And so the Divine Nine, which is the nine most predominant sororities and fraternities in the African American community, did a COVID-19 outreach, COVID testing, and of course it had to be at a church. Now I'm segueing into what else is at the church. So a lot of churches have music ministers, the minister of music, and oftentimes when you look at, even back to Aretha Franklin's video that she did in the church, the music minister, he did not look like he was in a traditional gender role. And so oftentimes music ministers may be gay in the Black church, and the pastor will give a sermon that is, I'm going to say it, homophobic. They will say things that are not nice about people who are homosexual. All the while, the music minister is right there with the choir, just, blasting out beautiful praises to God But the pastor has just thrown this gay person under the bus. And the congregation is in the room, watching, seeing, applauding it, co-signing it. And so one of the things that we have to do is we cannot continue to turn a blind eye to these dynamics, right? Just because it's comfortable and familiar and sustaining stigma does not mean it's healthy. And so at some point, getting in the room with Black pastors and saying, hey, okay, you know your music minister is gay. Let's just love on, how are we gonna change the message? Okay, how are we gonna be all in this together, making sure we're all healthy, okay, making sure we're all happy, making sure we're all doing God's work. How are we gonna do this? Because we really are all in this together.
Well, let's be honest about we are in this here together. We are currently in a divided nation, and that divided nation comes down to our divided communities. And I know that once space is created, so wherever you are most comfortable at, you can address how HIV has impacted your life. Then there's this time to welcome others, particularly those who you're not so maybe familiar with. They may not be your neighbor, they may not be a coworker, but to be very intentional about saying, hey, here's a space here, and I invite you to join me to talk about how HIV has impacted the ones that I love. I come from that environment where in 1992, there was a safe space for Black men to gather around HIV, because in the 80s, that wasn't the case. And I was a witness to that. And so when there's a need for crisis to be dealt with, space should be afforded, but we should recognize those spaces, and that's the key. To recognize those spaces, not necessarily demolish, but recognize and say, hey, these people, these unique people, or those people over there, they're doing something. Can we join them? Can we assist? Can we learn from? And I think that's a great way to combat it. I've been a witness to that. So I've seen that work, and I do believe that could continue to work.
Yeah. So earning trust is really important to me to be able to provide high quality care for my patients. So I have taught myself to be intentional and thoughtful about the language that I use, and choosing the right words and using supportive language. For example, instead of HIV positive patient, using the word patient living with HIV or person living with HIV, instead of to pass on HIV, so using the more medical words like transmitting HIV. So teaching myself some simple changes in the way how I ask questions has helped a lot to build trust and to break the stigma. And also a few more simple things like asking permission before you asking sensitive questions. So saying apology if you haven't used the right words, those really helped. And also peer education plays a huge role to break the stigma. And another thing that we have done at the organization level is partnering with local organizations like Health Department, Red Project, and also increasing the outreach, which will in turn enable patients to have more knowledge and access, not only to PrEP, but also for other programs like getting condoms and syringe service programs. So those are some things we have done, or I have done, to break the stigma.
Knowledge is powerful. And a lot of things that we are fearful of is because we don't have the knowledge. We don't know what's going on. Increasing the awareness, the stigma of HIV and AIDS we have to let those who have contracted the disease, HIV, it is a disease, and you are still a person. No matter what your disease are, you still a human being, and you need to be treated with compassion, consideration, just like any other disease, and people don't understand that. They feel that stigma. I can't let anybody know. What are they going to think about me? So we have to increase the knowledge, the awareness. How does this disease spread? When they know what to do, then you can do. As I say, when you know what to do, you do what you do. And so, but if you don't know how to protect yourself from getting this disease, if you don't have the information you need to protect yourself, then how can you protect yourself? So increasing the awareness, with the disparity of healthcare that's out here, and we know that there's a disparity in the African American community. So having those resources, being example, we as educators and leaders in the community has to be an example. We can't show that we are all, all that, and we have to reach back and let others know that we are here in this together. When you fall, I fall. When you mess up, I mess up. We're in this together. We're going to pull through this. We're going to struggle through this and get out of here together. So when you get out of here, we all going to share the victory, because we have come through this together. And the stigma, we all have something in our closet that we might not want someone to know, but we have to be transparent sometime and let others know that we have been there. We have gone what you are trying to go through. So just come on, let's hold hands. It's, as I say, it's two is better than one. We can tread this water. You hold me up on this side, and someone else hold me up on this side, and we're going to get through this together. We're going to be powerful. We're going to come out victoriously, because we're going to know what's going on. We're going to be included. We're going to have the knowledge and understanding of what's going on. So when we have togetherness and being there with each other, nothing can stop us.
Certainly, we're in this together means just that. And how do we continue to foster positive relationships through education, through health care, but most importantly, in my community, having courageous conversations, being able to be that voice for people who are suffering with HIV or living with HIV and AIDS, and also creating a sense of awareness to make it comfortable to have that discussion. It plagues all communities. However, it disproportionately plagues communities of color. And again, the only way to do that is have those courageous conversations. What I do know is that science and medicine have come a long way.
I feel that a way to challenge that would be to, just try to be mindful that this is still a situation and that it needs to be tested if you think you are. You need to kind of protect yourself to prevent the spread of it, even if you aren't. My challenge is that I feel that the challenge is people should really, really consider using protection, getting information about it, And if you feel that you may have come in contact with someone, get tested. It's not as scary as people think. If they get the information, then they can know that there is help, and if you're not detectable, you can't spread it. And so they need to take their medicine if they have it. If they don't have it, they need to be tested and be careful and wear protection. Use protection, I mean.
As an emergency physician, I am blessed to engage in honest conversations with my patients. When relevant, I take those opportunities to educate patients, young and old, Black, white, Latino, rich and poor, about HIV transmission, prevention, and treatment. I believe that we can channel this year's theme that we are in this together in several ways. We can intentionally create safe, judgment-free zones to discuss HIV transmission, prevention, testing, and treatment, including chronic treatment. We can encourage each other to get tested together, maybe talk to a friend or 5 and agree to go get tested together. Finally, I think it's so important that we all commit to advocating and voting for policies that increase access to health and decrease poverty in our communities.
Well, I think that the stigma in the Black community is really great, and I think that again, I think that much of it, when you talk about HIV, much of it is associated with gay lifestyle and our gay LGBTQ, and and the Black church generally perceives LGBTQ or homosexuality as a sin, and so many people then are being like influenced, by the church, by their religious perspectives in that, and biblically, and for me, I think that everybody has like a faith foundation that is very real and valid for them. And so I understand like that from a faith standpoint, and it's an area that I'm very clear that I struggle with, myself, again, in the way that I, understand religion and so on and so forth. And but I think that the younger generation in particular have a broader view, and having worked at like Hope College, and again, like I've had different opportunities to meet and to build relationships that I think that other people have, and it has afforded me an opportunity to have my own journey of broadening my perspectives based on the relationships that I've had, especially with the younger generation. So I see the stigma changing. I think that within my own family, I think the stigma has changed quite a bit within families around me. I have seen the stigma. So I do see some change in the stigma. I think it's still there. I think it's very prevalent still in the church because of the association with homosexuality. And so not even like separating, like HIV is not a homosexual, virus. Everybody can contract this virus. And so I think that first and foremost, building that understanding, and also because it is, sexually transmitted, in anybody who is sexually active, who's not, taking preventive care, especially wearing condoms, like anybody, your child, your grandchild, like anybody can get HIV. And I think that, always considering, like someone else's shoes, it's already hard enough, right, to have a virus that is stigmatized, and then to be like rejected or in some ways like condemned for it, it makes it even harder. I think that, which also impacts the spread of the virus, because certainly if you know that your community is very judgmental or critical and of it, then you're not going to be as likely to go and get help, or even medical treatment. You're gonna ignore the symptoms and spread it more. And so I think that Yeah, the stigma it's like it has a multi-dimensional impact. So I am glad to see that the younger generation, particularly in the African American community, are changing that, and they're also influential at their dinner tables, or in their conversations. Because, like I said, I'm a very transparent person, and and so I've had to like overcome my own like stigma and perception and knowledge, and a lot of that has come from my own daughter saying, hey, like, yeah, these attitudes need to be changed and they need to be shifted. So I'm seeing that in the younger community.